Thank you for that live report. A Western Mass tick testing company has now found several ticks that have tested positive for the Powassan virus.
Not long after a Connecticut woman in her 90s died of that tick-borne virus. Taking a close look under the microscope, extracting DNA, scientists at Tick Report in Amherst are busy testing around 1,000 ticks a week.
June is going to be the worst month of the year for deer ticks, really the riskiest tick bite you can get.
Deer ticks are the primary carrier of Lyme bacteria and the much rarer Powassan virus.
This year has been a little bit funny for Powassan, where normally we see 2 or 3 per year. At this point, we've only tested half of the ticks we normally do, and we've already seen 3 positive results.
Education Director at Tick Report, Paul Killinger, says with the small sample size and it being so early in the year, this might not mean a whole lot. But with the recent deadly case of Powassan virus in Connecticut, the lab is keeping a close eye on it.
It seems like the worst outcomes do come with people who are already at risk, either with immune conditions or just because of age.
Killinger tells Western Mass News the 90-year-old woman's age may have been a factor. Many people exposed to Powassan virus never feel sick, while others become severely ill with an infection of the brain, encephalitis, or meningitis.
A lot of actually similarity to the symptoms of a concussion. That's kind of the cheat way that I like to think of it.
Symptoms can develop between a week and a month after a bite and include fever, headache, vomiting, weakness, confusion, speech difficulties, and seizures. 10% of those with a severe form of the disease will die. There's no vaccine or known treatment. Thankfully, it's rare, but not unheard of in the Bay State. In the past decade, there were 100 cases of Powassan in the U.S. 16 of those were in Massachusetts.
So this is a dog tick that has fed so long that it doesn't even fit in the frame.
The longer a tick feeds, the riskier it is in transmitting a disease.
When we see ticks that have fed for 3 or more days, there's at least a 50% chance that it came from the hair of a child under the age of 12.
So Killinger says to check your kid's hair daily, use DEET on the skin and spray your clothing and shoes with the insecticide permethrin. Killinger says that spray is safe for pets as long as you let it fully dry, and it can last on clothing for about a month.